Is there surgery for glaucoma? Can I have surgery for glaucoma? These are some of the questions that I get asked in my practice on a weekly basis. If you're interested in eye health or content like this, please subscribe to this channel. So, surgery for glaucoma. In order to understand what surgical options there are for glaucoma, we first of all have to have a good understanding of what glaucoma is. I have a whole video about glaucoma, what it is, how we treat it, how we monitor it, and I'll link to that here. Briefly, glaucoma is an optic neuropathy. The optic nerve takes the information from the eye and sends it to the brain. There are about 1 million fibers that go through the optic nerve, and when someone has glaucoma, those fibers are slowly lost. The goal of treating glaucoma is to preserve vision. We want to preserve the vision the patient still has. Unfortunately, once someone has lost vision from glaucoma, we don't know how to restore that vision. We've yet to figure out a way to restore and heal a damaged optic nerve. So the treatment for glaucoma is all preventative. We're trying to prevent further damage to the optic nerve. How do we do that? We know that if we lower the pressure inside the eye, it decreases the rate of optic nerve damage. And in most patients, we hope to lower the pressure enough to prevent any further damage from occurring. So the treatment for glaucoma is to lower the intraocular pressure or the pressure inside the eye. How do we do that? There are three main modalities that we use or employ to lower the pressure inside the eye. Number one is laser, SLT, or selective laser trabeculeplasty. This is a very short procedure that stimulates the part of the eye, the trabecular meshwork, the part of the eye that drains fluid, to function better. You see, the intraocular pressure or pressure inside the eye is a function of two variables: how quickly your eye is making fluid and how quickly your eye is draining that fluid. The balance between the two determines the pressure inside the eye. So to treat glaucoma, we want to increase the rate at which fluid leaves the eye. The other treatment is to decrease the rate of fluid production. So, as I mentioned, one treatment modality is SLT, or selective laser trabeculeplasty, which stimulates the drain of the eye to function better, therefore drain the fluid from the eye more readily. Therefore, fluid doesn't build up inside the eye, therefore the pressure is lower. So treatment number one, laser therapy, SLT. More and more we're learning that if we do SLT earlier in the disease process, or as soon as the patient is diagnosed, patients end up doing better. So we offer SLT or laser as first-line therapy for patients who have glaucoma. Number two, eye drops. We can use eye drops to treat patients who have glaucoma. Eye drops will lower the pressure inside the eye by increasing the rate at which fluid leaves the eye, or they can decrease the rate of fluid production. So there's laser, there's eye drops, and then there's surgery, which is the whole point of this video. I made this video to talk about different glaucoma surgical options. Most people who have glaucoma probably will not need to have glaucoma surgery. But if someone does need to have glaucoma surgery, we can probably think of these surgeries also as being in three broad categories. Number one, we can do a surgery that enhances the natural drainage system that you already have. These are typically minimally invasive glaucoma surgeries, or we refer to them as MIGS surgeries, minimally invasive glaucoma surgeries. Most of these surgeries work by enhancing your natural drainage system. Without getting too, well, it's going to be a little bit technical, but what we're doing is either stenting that part of the eye that drains fluid, or we are injecting gel into that part that drains fluid, a canaloplasty procedure, or we are excising some of that tissue that acts as a resistor for fluid to leave the eye, and that can be a goniotomy procedure. But there are a whole host of surgeries that fit into that category of minimally invasive glaucoma surgeries. So that's one category of surgery for glaucoma. We want to enhance the natural drainage system of the eye. And in someone who has mild to moderate, sometimes in patients who have a more advanced glaucoma, we will utilize and employ one of these surgeries. So category number one are surgeries which enhance the natural drainage system of the eye. Category number 2 of glaucoma surgeries are procedures where we say, you know what, the natural drainage system of the eye is not working well enough. No matter how much we try to enhance it, we just can't get the pressure down low enough. For those patients, we create a brand new pathway for fluid to leave the eye. And these can be filtering procedures such as a trabeculectomy, it can be a Zen stent procedure, or it can be a glaucoma tube or glaucoma drainage device. All these have in common is that they shunt fluid from inside the eye through the sclera, through the wall of the eye, into the subconjunctival space, a potential space which exists outside the wall of the eye, outside the sclera. In this space, there's very little resistance to outflow, so we could potentially get the pressure to be quite low with this category of surgeries. So, number one, we can enhance the drainage system of the eye. Number two, we can abandon it altogether and do a glaucoma filtering surgery or a trabeculectomy or a glaucoma tube. Third category of surgeries are cyclodiode procedure or transscleral cyclophotocoagulation or endoscopic cyclophotocoagulation or ECP. These procedures destroy some of the cells inside the eye that actually make the intraocular fluid. If we can destroy some of these cells and the eye makes fluid at a slower rate, then the pressure inside the eye will be lower. So that's glaucoma surgery in a nutshell, a brief overview of all the different surgical options. There are actually new glaucoma surgeries, especially in the MIGS space, that are being developed and actively researched. And each year we find more and more options for our patients. That's fantastic. But it also means that we have not found the perfect surgery that works in all patients, which is why different patients require different surgeries, and which is why it's really important to discuss glaucoma surgical options with your ophthalmologist. The idea for this video came from a patient comment, a patient question. If you have questions, please don't hesitate to comment. I'd be happy to answer them, and perhaps it may give me ideas for more videos to make for you. I hope you found this helpful. Please feel free to reach out. Thank you very much. Have a great day.